Buenas tardes and good afternoon. Welcome to a very special charla in partnership with Let's Stop HIV Together to commemorate National HIV Testing Day and the 40th anniversary of the first report of AIDS in this country or in the world 40 years ago. And I'm old enough to remember the early 90s when I was working with the Whitman Walker Clinic here in Washington, D.C. and similar clinics in New York, alongside of my padrinos, Hector Torres and Jay Haddock, as well as friends like Larry Villegas, who will be one of the oradores today. I remember all of those people who are no longer with us that perished from this terrible disease. And anyone that's old enough to remember those times remembers that it was a tragedy happening, it seemed like several times a week. Back then, to be HIV positive seemed like a death sentence, but it's not. And I have dozens of friends right now that continue to live long, beautiful lives. But we also need to make sure to continue to educate our communities about HIV and AIDS through a 2021 lens. And although it's 40 years later, we are still addressing this issue, which affects young, Black, and Hispanic Latino men disproportionately. The Latinx community accounts for almost 30% of all HIV infections, a rate 4 times the rate of whites. At year-end 2019, an estimated 1.2 million aged 13 and up are living with HIV infection, including about 13% of people whose infections have not been diagnosed. And that's why we're doing this charla today. We are grateful to Let's Stop HIV Together and our friends at Westat HealthComs and the CDC for the inspiration. And of course, the HHF team who puts these charlas together almost weekly for the last year and a half. And it's remarkable when you're working alongside of people that are doing so much work. I also remember working with Hector and Jay to create the first fundraiser to raise resources for the Latinx community. And fast forward to this charla, and it's just our way of supporting valuable members of our community who need some inspiration, some support, and of course, shared experiences. So we appreciate today's charla speakers who will continue to speak, listen, connect, and act, which is what we try to do through the virtual charla series. I also want to encourage everyone to use the chat feature for this charla, but please set it to everyone and not just panel. That's the default for some reason, but take a moment right now to do that because we want everyone to hear your thoughts and feel your energy. So let's get started. And I want to start with a very special man and a very special friend to me who I've known since we were coming up in DC as activists, and he's still at it every single day, con ganas. He also joined us as part of a delegation that we took to the border of Mexico and Texas in support of unaccompanied minors and families. So please welcome Larry Villegas, who is a DC mental health practitioner, an executive coach, and a hypnotherapist, which is why I don't look into his eyes. So we are thrilled to have Larry here, and vámonos, Larry.
Good afternoon y buenas tardes. Like Antonio said, we have been friends for a long time when we were both collaborating with Whitman Walker Clinic, when talking about HIV and AIDS was dying, the first thing that came to mind. But before I continue, I just want to take a moment for everybody, wherever you are, to take a deep breath, to center ourselves in this moment, and to, yes, celebrate our accomplishments, but also to remember those who are no longer with us. There was a time when this was a homosexual pandemic, when being a homosexual was a death sentence. And many people, including me, turned to the church to join an ex-gay program, because if you were not homosexual, you would not get AIDS and die. That was the sentence. And what we wanted to do was to actually embrace ourselves from the mental health point of view and grow out of the fear, grow out of the bullying and depression and anxiety. 3 things several times I'm going to share with you this afternoon. We went from dying to surviving to thriving. And we need to go back to testing, to prepping, and engaging. The way we do this is all together. We cannot do this by ourselves. And let me add the element of equity and equal rights and equal access to information that many of us talk about it all the time. Yes, equality is important because we all need to go get tested. We all need access to services. We all need information. We all need to make healthy decisions. The most important thing is to stop, and this is going to be probably an unpopular opinion, but to stop bullying our brothers and sisters who don't look like ourselves. Stop bullying transgender people, making jokes about it, bullying people who are different skin color. Black Lives Matter, and that is important every day. So when we, as LGBTQ2A+, etc., because now we are the mafia of the alphabet, like TikTok says, we are the ones that have to embrace our diversity and our differences to make sure that when we say, let's get at the table, everybody gets a seat. It's not about just bringing everybody together. It's about changing the way we carry our conversations. So by embracing people and bringing them in, we are contributing to overcoming depression, anxiety, bringing respect and love, acceptance, so we can continue working on this together. Now, I cannot finish today without saying that testing is still an issue. We need more access to testing, not for us to go where the testers are, but for the tests to go where we are. 1, 2, once you know your results, either prep yourself or talk to your doctor about your options, but definitely engaging. Remember how we said it takes one to know one? Okay, so if I'm going to get tested, I'm going to tell Antonio, come on, Antonio, let's go get tested. Come on, Raul, let's go get tested. So we take care of our community every day. Mental health is important. Acceptance of who you are is important. Acceptance of who your brothers and sisters are, our differences, are what things bring us together is important. But until we act on it, we're going to continue dying alone and separated. My call today is for all of us to join together, arm in arm, and go get tested, get prepped, get medication, and engage other people in the same movement. It is time to act. And with that, thank you very much for your time.
Thank you, Larry. And I also want to say too that it's just so different now. I remember back then as a straight man working on this issue, and the straight community was saying, why are you working on that issue? And the LGBTQ plus community was saying, why are you working on this issue? And I was somewhere in between there, like going, look, this is a humanitarian effort, right? But what's beautiful is that my kids don't think that way. And I remember even working on this issue, there were a lot of issues around race and around who was being helped around the trans community. So thank you for bringing all those things up, because if as a community, if we're so against building walls, why do we build them between each other? So it's important to do that. So next up, and we are thrilled to have Francisco Ruiz, who is the team leader for Prevention Communications Branch of the National Partnerships Team for Let's Stop HIV Together, CDC Division of HIV/AIDS Prevention. Francisco, that's a long title.
I know. I have to use it often too. So thank you for having me. As you mentioned, tomorrow, June 5th, the world will mark 40 years since the first cases of what later was known as AIDS were officially reported. In the 40 years since these initial cases were reported, we have witnessed the tragedy of over 700,000 lives lost in the United States. but also the triumph of our collective progress in HIV prevention and treatment. And it is because of that progress that we have brought our annual numbers of new HIV cases to an all-time low. So we must applaud those efforts that all of us collectively have done. But as the HIV epidemic evolved in the United States, profound disparities, as we know, by race and ethnicity emerged that persist today. And too many people are still not getting access to the treatment and prevention that we need. So addressing these continued disparities will be crucial, and it takes all of us. You know, data has shown that HIV prevention and treatment services are not reaching many of those who could benefit most. And so African-American community continues to face the highest rates that are more than 8 times higher than whites. As you mentioned, Hispanic Latinos face rates that are 4 times higher than whites and continue to experience greatest barriers to accessing prevention and care. In 2019, only 8% of African Americans and 14% of Hispanic Latinos eligible for PrEP were prescribed it, compared to 63% of whites. In 2019, just 61% of African Americans and 65% of Hispanic Latinos were diagnosed with HIV or value suppressed, compared to over 70% of whites. Transgender women also face significant barriers, and we must talk about that collectively. Recent reports found 4 in 10 transgender women surveyed in 7 major cities have HIV. The South also, so you have to look at our geographic work, is disproportionately affected. People with HIV can live longer, healthier lives. We all know that, thanks to improved treatment, and powerful prevention tools such as PrEP can help prevent HIV transmission if those are taken directly as prescribed. But longstanding systemic health and social inequities include discrimination, homophobia, transphobia, stigma, poverty, systemic racism, homelessness, and the list goes on, unfortunately, prevent access to testing, treatment, and other prevention services, and further drive inequities. And today we're talking a lot about race and race relations. We're talking a lot about health issues such as COVID-19, and let's bring HIV to that space in that conversation as well, and maximize and lean into sort of the collective movement that we're seeing across the country. Only by addressing the root of these causes, of these inequities, and pursuing innovative solutions designed to reach people where they are, as you mentioned earlier, as Larry mentioned, we could end this HIV epidemic. So to commemorate the 40th anniversary, the U.S. government, so on behalf of CDC, as I represent, as you mentioned, is coordinating events and activities across the federal agencies, as well as our federal partners and non-federal partners to end the HIV. And so we've called it 4x40. So being reflect, recommit, re-energize, and re-engage. So reflect on the many lives we have lost to AIDS and rededicate ourselves in their honor. In their memory, we will not stop until we end HIV in the United States and around the globe. Number 2 is recommit. Recommit to ending the HIV epidemic at home. And that means a commitment by the administration to increase investment in global and domestic health programs, including those addressing HIV. Number 3, re-energize. Re-energize the HIV response domestically to ensure equity and regain progress lost to COVID-19. We've been doing this work for 40 years. Many would argue even more than that when we talk about our health inequities. And so we must recommit, re-energize. This requires reinvigorating and diversifying the HIV resources and the HIV response to ensure equitable access to prevention, care, and treatment services, especially for those impacted by HIV epidemic. And those efforts must be by the voices from the communities most impacted. And so we must also not only have them at outreach workers, Latinos who speak Spanish at outreach workers, but also at the policy level, making the decision and identifying where funds are going. And number 4, re-engage. Re-engage all sectors of society to end the HIV epidemic. So the U.S. government cannot end this alone. We know this. We need to continue to contribute contribution and innovation from all sectors of our society, all of those who are watching, those who think maybe I'm just kind of attending this just to learn a little bit more. You all have a role. So together we must re-engage. We must continue to empower and strengthen our coordinated response. And so we must also ensure, as I mentioned before, that our communities are part of this solution, that we are sharing our lived experiences in these solution-oriented activities, and so that in the planning and the development and the implementation of these activities. So on behalf of the CDC and in the U.S. government, I invite everyone to continue with us in this journey. For those who are looking for resources, stop by cdc.gov/StopHIVTogether. Follow us on Instagram at StopHIVTogether, or email us if you want to get involved. Email us at stophivtogether@cdc.gov. Thank you.
Thank you so much, Francisco. That was very thorough. And I like how you laid it out in terms of the statistics and then the actionable steps and resources. Next up is Earl Fowlkes, who is the president and CEO of Center for Black Equity. Earl, we appreciate your presence and look forward to your perspective on this topic.
Well, thank you very much for the invitation. This was, and to follow such esteemed leaders as Larry and Francisco is also an honor as well. And thinking about what I was going to say today, I had to think about the first days of AIDS, and I'm old enough to remember those days. And I became an activist, and I had to remember, how did I become an activist? What spurred me on to becoming an activist? And what spurred me on to become an activist is when I was working in a hotel in Atlanta in the early 80s. And remember, we were told, at least I was told, that Black and Latinx people don't get HIV. It was a gay white disease. So many of us took that information, even though it was faulty, and applied it to our lives. And I was working in a hotel, and I was a restaurant assistant manager, and two of my employees who were bartenders got very ill. One was Latinx and the other one was African American. And they became very, very ill very quickly, and they needed some disability forms completed. And in those days, people would file for disability. Unfortunately, the checks would come after they passed away. And no one wanted to take these forms to these guys. They lived together, they were partners. And I said, I'll do it. And they said, no, you're gonna get sick. I said, no, that's ridiculous. You can't get sick by just taking care of sick people. That's absurd. And I went to their house, their apartment, and I remember how much they had lost, how much weight they had lost. And there was skin and bones, and no one had been bringing them food. This is before Ryan White. This is before HOPA. This is before charities were developing we took care of each other. And until they passed away, I brought them food like every other day. And I didn't do it because I had to do it. I did it because it was the right thing to do. And those were the kind of actions that everyone, not just me, there are thousands and thousands and thousands of people who stepped forward at the right time to take care of their neighbors, their sisters, their brothers, and their relatives and friends. As we think 40 years later, where are we? Where's the activism? Where are the red ribbons? Where are the protests? You know, you look at how the world is now. We lift Dr. Fauci up. Dr. Fauci, we used to protest him back in the day, in the beginning of the pandemic. I think what's missing is a call to action. We've become very complacent we got medicines and people are living longer and there's housing available, but this is a preventable disease. No one should be getting HIV. And the call to action is getting rid of the barriers that prevent people from accessing PrEP, to accessing testing, accessing life-saving medicines, getting rid of language barriers, getting rid of country of origin barriers. Anyone who's breathing the air in the United States should have access to everything that's available. And that's where the call to action. We need to demand more from our government. We need to demand more from our communities. People should not be dying of HIV/AIDS, and they are. HIV disease, I should say that, but they are. And what I hope to instill to you all today is that there are many people in different communities, the Latinx community, African American communities, other communities who are willing to work together. We used to work together more. We used to do things and we used to share resources, and there weren't many resources. But you know how it is when when you're economically disadvantaged and you have a pot of soup and someone else comes by and you always find some extra soup for that person. We need to work together to recapture the spirit of activism and challenge that we had back in the 40 years ago. So I would say, I'm committing myself and my organization and the community who will follow me to working with the Latinx community to eliminate barriers for people living with HIV/AIDS and for people who are trying to prevent themselves from being HIV positive. This has to happen. Otherwise, we're going to have 60 years and 80 years. And if we can find a cure for COVID-19, we can certainly find a cure for HIV/AIDS. Thank you very much.
Thank you very much, Earl. It's a great perspective and we appreciate it. And now please welcome Marco Benjamin. He is the National HIV Liaison at CVS Health, and shout out CVS Health, who are wonderful partners of the Hispanic Heritage Foundation year round. Marco.
Yes, thank you so much for having me. I'm Marco Benjamin, and here listening, today with you guys, I just realized I'm as old as AIDS, right? And I've been HIV positive for 13 years, representing our Latino community, very much on the forefront. And it's just mind-boggling that AIDS is just as old as I am. I appreciate to be here today with you guys to have these platforms and to continue this conversation around HIV/AIDS, which is still affecting our communities. And as many of us have stated here today, together, right? Only together, we can win the war on HIV. I'm very hopeful that within our lifetime and my lifetime, we will see a cure for HIV here in the United States. When we think about some of the barriers to care for the Latino communities and across the country and really across the world, it's really, in my opinion, addressing some of the social determinants of health. Before that, you addressing some of the housing and lack of housing disparities, food, and just social disparities, mental health. Some of those things are what's really creating some of the barriers for our communities to really remain HIV negative, and then also our HIV positive community to remain on treatment. I'm honored also to have an opportunity at CVS Health, where once I was the activist outside of CVS Health's door, screaming and yelling, trying to create change. To be able to have a platform to help create effective change, not only for myself, not only for Latinos, but anyone that's at risk of contracting HIV. In alignment with our friends at the CDC, we at CVS as well are reflecting on our commitment to be a key state partner in ending the epidemic. Again, knowing that we need to do this together, we need to also be that key stakeholder here. In this, we've highlighted 4 pillars internally at CVS, where we are going to commit to re-educate and provide more education for our corporation, also the enterprise, as well provide some innovative access to testing. As Larry did state, at times we expect folks to come to us to test. We need to bring testing to them. And now with very new innovative waves around self-testing or self-collect testing, I think now's the time that we can be able to really change that curve and get more folks tested by bringing those testing capabilities into the hands of patients. Access to care for insured and uninsured, working together with some of the community-based organizations and the federally qualified healthcare centers to really instrumentally provide those life-saving services and treatments for our patients. And then most importantly is adherence, right? It is important that we continue to provide new means of prevention methods, but it's also very important not to forget the ones who are HIV positive, and just to provide some support of retention to ensure that the HIV positive community remains undetectable and will not be transmittable. I'll stop there for now. Thank you so much for having me today. I really appreciate this opportunity working together with you guys, and look forward to be a key stakeholder within ending the epidemic.
Thank you so much, Marco. And now we go to Taylor Lianne Chandler, who is the Transgender Health Coordinator at Us Helping Us, People into Living, Inc. Taylor, good to have you join us. Can't wait to hear what you have to say.
Thank you all for having me here. What an amazing day, but it'll be a better day when we don't have to celebrate, or I don't even know if celebrate's the right word, an anniversary like this. My exposure to the HIV/AIDS epidemic was far later than probably most of you, because I lived in this traditional for lack of a better word, because of the color of my skin, white world, that it didn't affect quite the same way. But in 2004, my ex-husband, who dealt with opiate addiction, was the victim of a 3-strike law in Florida. And when he went to prison, you know, his addiction led him to doing things to suffice that addiction. When he got out, he was diagnosed with HIV. And a year later, on Martin Luther King Jr.'s birthday, he went to get services, not realizing that those services were closed that day. And on the following day, they found him under a tree and thought he was a homeless person, just asleep. He had gone into a diabetic shock, and then he had passed away because of not taking his medication the way he should have. And that was my first introduction to what HIV and AIDS can do, and to lose someone so phenomenal and close to me. And that has led to the work that I do today. I have so many friends that are living such healthy, wonderful, beautiful lives with HIV, but I still am working with the Black and Brown trans community. Again, I see such a huge community that doesn't get the resources they need to prevent these things from happening. They're not afforded equity or equality to access for mental health or medical care to prevent something that is so preventable. At Us Helping Us, you know, we were founded 36 years ago as a holistic approach to Black gay men dealing with being diagnosed with AIDS and making their life comfortable because there was no living with it. And here we are 36 years later, and our mission hasn't changed. That same amount of people that is dying every year is still Black and brown. And my experience here, being in the District of Columbia and dealing with the bureaucracy that we all do to funnel and provide the services that we do, is from a government standpoint on down, we don't value Black and brown lives. And under the last administration, that was amplified. And to this day, now people can be outright with the way they feel about people that they don't see as normal or different. You know, Dr. DeMark Hickson, you know, who is my executive director, even before he was at Us Helping Us, you know, had such a passion for working in this field from a background side to try to make it, you know, easier to get the access. But as long as we have large organizations that are still getting the funding, and the people, when you walk into those offices and institutions, don't look like the people needing services, we're still going to be at a disadvantage. And so I try every day in the work I do as part of a TGNC 18 to 24 homeless or at-risk program for Black and brown trans individuals to make sure that their voices are heard and elevated, to make sure that they have access to things that should be the same for everybody. And I use the privilege of being white to be anti-racist, to be anti-LGBTQ issues, and to fight the phobias that affect us all. I am part of this community, born intersex, identify as trans, and I'm proud of it. And I'm proud to have the platform that I do, and I'm very happy to use it any way I can to elevate voices that still in 2021 need help. And I think everybody that comes from any form of privilege should, I hope the call to action would be to use that to elevate the voices, open doors, let people tell their story, don't tell it for them, and create visibility. As part of my duties as the Flux AHF president here in DC, we are launching 3 PSAs. One of them is a Latina trans woman, and it's elevating civic engagement, unity, and youth. And we talk about all these things. And I can't wait to expose it because the hashtag is CS Trans. And like was said by many others, trans individuals are part of that current statistic, dying, not getting the services or help, or even getting on PrEP. So thank you for having me. If you are in Washington, DC, I encourage you to get tested, know your status, come into us helping us. There's many orgs here that offer these services. And throughout Pride Month here, a lot of the Pride events are going to have testing at Capitol Pride events. So there's no reason to not know your status. And everybody's offering PrEP so easy, it can come to your doorstep. You don't even have to come in. So thank you all for this platform. And, you know, I won't be here in 40 years, but I hope 40 years from now, we're not doing this again.
Thank you so much, Taylor. And please let us know how we can help amplify your important work. I mean, that's part of what we do here too, is connecting everyone so that we don't work so isolated. And certainly for us to be able to amplify it in the Latinx community outside of the traditional channels in this area, it's our privilege to be a part of anything that anyone here has that'll help our community. So next up is Jorge Miranda, who is the facilitador de Grupo en Impacto LGBT. Gracias, Jorge, dale, en español.
Sí, gracias. Bueno, yo quiero iniciar con una experiencia personal. Quiero compartir con ustedes un poquito de mi historia y por qué estoy trabajando ahora acá en Estados Unidos con este tema que me apasiona también. No sé si está listo el video.
Descubrió que tenía síndrome de inmunodeficiencia adquirida a la edad de 27 años y desde entonces inició la lucha para vencer la muerte, los estigmas sociales y la discriminación. En busca de un tratamiento médico, presentó un recurso de amparo ante la Corte Suprema de Justicia. Debido a la falta de respuesta oportuna, demandó al Estado salvadoreño ante la Comisión Interamericana de Derechos Humanos. Ante la denuncia, el gobierno, a través del Instituto Salvadoreño del Seguro Social, inició la entrega de medicamentos antirretrovirales.
Para mí es satisfactorio el ver que hace años, cuando yo inicié la lucha, hubieron personas que me cuestionaron, me preguntaban cómo era posible que yo iba a demandar al gobierno si el gobierno era un monstruo y una sola persona queriendo cambiar las cosas era imposible. Y bueno, lo que yo respondí fue que no hay peor cosa que la que no se hace.
Odir fue la primera persona en El Salvador que se atrevió a decir públicamente que tenía SIDA. En ese momento, su único apoyo fue la familia y un par de amigos.
Parte de la valentía es luchar por la vida. Lo importante cuando yo decidí dar la cara fue precisamente eso, porque yo quería vivir y aparte de eso estaba viendo a mi alrededor la discriminación, el estigma que existe hacia las personas que ya vivíamos con VIH y que nadie hacía nada.
Odir se convirtió en un referente de lucha para quienes viven con el VIH y para las personas que se identifican con la defensa de los derechos humanos. Gran parte de las personas que viven con el virus tienen acceso a los medicamentos en el Seguro Social y en los hospitales nacionales.
El acceso a medicamentos, la creación de una ley, el que el presidente esté hablando ahora del tema, aunque lo hable, ya es ganancia. Que haya discusiones fuertes sobre el tema de atención y mejorar la ley que existe de VIH, creo que son cosas que nosotros pusimos en la agenda. Y lo hicimos las personas que vivimos con VIH. Y puedo decir lo que yo me siento sumamente satisfecho. Vamos marcando pasos, vamos librando una batalla. Y una batalla fuerte la hemos visto desde la primera etapa que ustedes vieron de mi vida, como la que estoy viviendo ahora, 100% entregado al tema de VIH, y también de ver la manera como las personas que vivimos con VIH aprenden a ver la vida de una manera diferente, desarrollarse, capacitarse y tener oportunidades de trabajo que nos permite que no nos vean como una carga social.
Bueno, gracias nuevamente por darme la oportunidad. La siguiente, por favor. Hablar un poquitito, nada más decirles que somos Impacto. Yo estoy ahora trabajando acá en Virginia, en el norte de Virginia, apoyando a Impacto LGBT, una organización comunitaria que busca fomentar liderazgos en la comunidad LGBT de esta área del estado. Y bueno, buscamos también ser una organización innovadora que realmente empodere a la comunidad LGBT latina. La siguiente, por favor. Somos como ya decía, somos un grupo comunitario independiente liderado por Víctor, no sé si algunos lo conocen, fue fundador de Impacto. Y bueno, desde el 2017, él pensó que era importante porque no existían espacios para la comunidad LGBT en esta área y decidió pues iniciar este proyecto. La siguiente. Nos hemos enfocado en varios temas, pero del que yo hablo esta tarde es nuestro programa de VIH, que ha sido un programa que creamos viendo la realidad de la que no se escapa nuestra comunidad. Y bueno, hemos visto importante apostarle a mejorar la calidad de vida de las personas, específicamente de los hombres gay que viven con VIH de esta área. Y es por eso que hemos creado nuestro programa que se llama Somos Familia. La siguiente, por favor. No lo hacemos solos, lo hacemos a través de alianzas, porque nosotros todavía no somos una organización totalmente constituida, estamos en ese proceso y bueno, necesitamos de aliados para poder cumplir con nuestras metas y también para tener un alcance a lo que estamos buscando y específicamente en el área de VIH, que le estamos apostando también muy fuerte. Nos enfocamos a las pruebas de VIH y otras ITS, pero en este momento pues estamos ayudando mucho en la parte específicamente de VIH. Navegamos los servicios de salud con las personas que nos lo solicitan, damos servicios de salud mental y bueno, tenemos recién este año estamos tratando de lanzar una campaña de prevención y también enfocada al tema del Día Nacional de la Prueba, ¿verdad? Entonces, promovemos también como una estrategia PrEP y otras situaciones que se dan en torno del VIH. La siguiente, por favor. Bueno, en nuestro grupo tratamos de empoderarlo y tratamos de que ellos no estén desconocidos sobre el tema de VIH y otros que están en torno a esto. Y para evitar precisamente situaciones como la que me tocó vivir a mí en El Salvador, pues hemos decidido también empujar mucho algunos temas y entre ellos está el estigma, la autodiscriminación, que hay una tendencia bastante fuerte en eso en muchas ocasiones y no nos damos cuenta. Cómo manejar el diagnóstico en el momento que nos dan el resultado y lo estamos haciendo desde la misma experiencia de las personas con VIH, ¿verdad? Hablamos sobre los tratamientos y lo que significa ser adherentes de U igual a U, que creo que todos lo conocemos. Hablamos sobre PrEP y hacemos pues visitas también domiciliarias cuando lo requieren. Y tenemos un convivio anual que es donde hacemos el intercambio de experiencias. El grupo tiene apenas año y medio, pero ha habido un avance bastante importante en esta área. La siguiente, por favor. Y bueno, con esto cierro la presentación. Decirles que quería compartir el video, no pude hacer esa introducción al principio, pero que quería compartir ese video porque es parte de mi historia, de lo que me tocó vivir en El Salvador, y eso es lo que me hace sensible y por lo que nosotros queremos trabajar fuertemente, y creemos que el Día Nacional de la Prueba, que fue algo también que se impulsó mucho en El Salvador y no se logró como está establecido aquí en Estados Unidos, pero creemos que es importante como una forma también de prevenir casos de personas ya en estado terminal. Y darles las gracias por esta oportunidad de presentarnos en este espacio.
Muchísimas gracias, Jorge. Gracias por tu trabajo. Please welcome next Alejandro Acosta, who is the Director of Public Policy and Advocacy at Southern AIDS Coalition, representing the West Coast, where we actually have our other headquarters. So it's important to have you here, Alejandro.
Hi, everyone. Thanks for having me today. I am super happy to be able to speak, to an audience. After 40 years of HIV, we still have a need for education. There is absolutely no doubt that for example, I'm not someone who's HIV positive. I'm someone who is living with HIV. We need to stop saying HIV positive because that puts all the attention into the disease instead of the human being. And that education has to happen even within our own community. It also has to happen with lawmakers and people who are in power, because those people are, in fact, in charge of our health. It seems impossible, right? But most healthcare decisions are made by politicians who are not healthcare experts. They might have people who they listen to, but we must make sure that lawmakers are educated in HIV, because those lawmakers have the opportunity to bring resources to their constituents. I have met lots of lawmakers who I am literally the first person they have ever met living with HIV. A lot of lawmakers still have erroneous, archaic ideas of what HIV is like, and they don't have an update of what it is today. I still hear a lot of sad stories and people who have really struggled and being impacted by HIV. But what we also miss is the people who are thriving, like myself and a lot of people out there who are living with HIV and who are living completely normal lives. Yes, stigma is extremely present, ever present, but that's why Latinx people and people like myself have to open up and speak openly about HIV and normalize the conversation. There's still, as I said, a lot of ignorance. I saw this as an ex-educator. I was an educator for 17 years, and I was at the end of my career, I was training teachers on sexual health, and I saw there firsthand how adults in power who are teachers were still trying to lead with misinformation and with a lot of religious convictions that sometimes dictate, I guess, what people have to do sexually, which is not compatible with sexual health. And so in the idea of testing, I live, for example, in Florida. We have great testing out east where most of the majority of the LGBTQ population live. But if you go out west, just 30, 40 minutes from here, there is nowhere to get HIV tested. So we must make sure that these resources are reaching everyone, not just a certain part of the population. If we think of a 17-year-old who might be sexually active and looking for a place to get tested, if that person has no car and has to drive or find a bus ride for 2 hours and then 2 hours back, it's not convenient. And this happens in a metropolitan area like Florida, like South Florida. It's happening also in rural communities throughout the United States. And so it is, again, important not to forget that the fight is not over, that we must continue to show up. And as I must tell you that as someone who is in policy, there is only a very few people of Latinx descent who are part of the table. So unless we get involved and we are part and demand to be part of the table, we're not going to be taken into consideration the way that we should. I will give you an example. When we think of Mississippi, we never think of the Latinx population that lives there. Mississippi is traditionally considered a Black state. It's not. There's a lot of Latinx people living there, working on the fields, working and being part of the community, who often go invisible, who often go unnoticed and uncared for. So unless we are part of the table and become part of the policymaking process, we are not going to see those changes to our community. So I believe that we should all get involved. If you don't have the time, this is it. This is the time. A lot of us are still working from home. You can write to your lawmakers. You can write to your coalitions in your state. Get involved locally with AIDS providers or AIDS service organizations where you can volunteer. And again, the best thing that you can do is not only educate yourself, but educate others. So at any point that you have the opportunity to speak openly and freely about sex and about HIV, do so, because there's people out there who might benefit from what you're trying to say, what you have to say. I think that is very important that we represent not only ourselves, but our people who don't have the language opportunity, right? By now, I'm bilingual, fully bilingual, and I'm very happy that Jorge was able to speak in Spanish. But there's also a need for language justice. There is a lot of people out there who don't speak the language and should not be deprived of the information. So we have to have information equity, and we also have to be able to show up at the table and be part of the decision-making process. So that is my 2 cents today. Thank you for the invitation. I really appreciate it.
That's more than 2 cents. Excelente. Good job, Alejandro. And our last Charla speaker is Raul Marca Terrones, who is the program manager for the Sexual and Behavioral Health Program at Wyckoff Heights Medical Center. Finish strong, Raul.
I know. That left me for the last, but yes. So thank you so much, familia. Muchas gracias, everyone. I hope they're having a good afternoon. So yes, my name is Raul Marca. Right now, I am a Let's Stop HIV Together ambassador. So I'm from Peru. So I came here to United States like around 13 years ago. So I came here to Brooklyn, New York, not knowing anything about HIV, not knowing anything about prevention. I was very afraid to talk about it. Why? It's because I think of my culture, or like the way they educate me over there, it was not the correct way we want to. So it was very hard for me to know about it and try to find resources, or try to find clinics, or try to find someone to talk to me about it. So that's how that life shows me one organization, and then I know everyone knows Latino Commission on AIDS, that they have an empowerment group. They invite me, and so that's how like my work, or like the way to work on this field starts. Being part of this group, of this empowerment group, that makes me a lot power. That makes me a lot like advocacy for this field, and this is how it starts. So now I'm the program manager at this hospital in Brooklyn, Wyckoff Heights Medical Center, and I'm very happy like how these years I'm being growing up on those fields, and then now be part of as the CDC ambassador for the Let's Stop HIV campaign is very amazing. Can we go next? Yes. So last year, we know we was everyone in the pandemic. We was inside working at home. So the Stop HIV Together, they just bring a new campaign. So what we record this campaign at home. It was very crazy those days, but the most important thing from those campaign is to bring this information, to bring everyone to know what about is HIV, what about is our, like, what is important to know our status, or what is different services, or what we have. So it was I was very happy to share a little bit my history, a little bit like how I help my friends, my family, my community, giving this type of information. So they make those videos, and I know they make some flyers. They're gonna be around with the CDC campaign. And now, next slide. that's what I was talking on the beginning. So this year I'm an ambassador. So I'm participating to empower our community to continue educating partners or healthcare or my healthcare providers, and to continue promoting testing, promoting prevention, treatment, and try to reduce the stigma, because we still have a lot of stigma on that community. So this campaign is part of the National Ending the HIV Epidemic in the United States initiative. So I'm so happy to participate on that. Next slide. So just gonna mention that next week, we're gonna have Instagram Live. So when we're gonna talk about like the Awareness Day, so the HIV Awareness Day. So this is how we work here on as ambassadors. So we collaborate with another 2 more ambassadors, Andres Campos and Ronnie Vasquez. Ronnie is from Puerto Rico, Andres is from Florida. So we start meeting each other by Zoom and talking like how we can continue educate, how we can impact our community. So we find out that our community is always in social media. They're always like looking on Instagram, they're looking on Facebook. So we bring the idea to start doing those Facebook Live, Instagram Lives, so people that can start kind of like hear what is going on. But this type of live that we're doing is not like a regular live, like just presenting information. No, it's just a conversation. That's why we put those live like hablemos juntos. It's like a common conversation, like you talking with your friends. It's just that. And we talk about like sexual health, we talk about HIV, we talk about adherence for medication, but we talk in a way like it's very fun way. So that's how we think like people, they're gonna get the information faster than just be like a little bit like boring, just listen to the same information. And then this is just a small examples for one of the lives we did with another ambassador from Chicago, Milani. That's the first play.
De lo que estaba haciendo, pero no, yo soy un ejemplo perfecto que el VIH le puede llegar a cualquier persona, no importa la educación que tengan, no importa los años que lleven haciendo el trabajo, le puede pasar a cualquier persona.
And the next video we're gonna play is, this is how we promote our conversation that we have. Like we have different types of informations or like promotions about stigma, adherence, PrEP. So this is one where we talk about stigma.
Hola, mi nombre es Raúl Marca y soy embajador de la campaña Detengamos Juntos del VIH del CDC. Te tengo una pregunta. ¿Por qué es importante detener el estigma del VIH? Es menos probable que las personas que traten de buscar servicios o que traten de buscar un tratamiento vaya a un centro. ¿Por qué? Por el miedo o por el discrimen que puedan sentir yendo a estos lugares. ¿Cómo podemos ver? Dejando de juzgar a estas personas que están tomando esta decisión de poder ir a buscar algo para su bienestar o algo para su salud. Así es que detengamos juntos el estigma del VIH. ¿Y tú? ¿Cómo detienes el estigma del VIH?
So with those types of like posts that we do in Instagram, on Facebook, we try to reach more community to know about it, to kind of like asking questions. So we respond those questions. So we want to be very interact with the social media that we know a lot, our like young community is on it. And then this is something important because we're going to celebrate the HIV Awareness Day. And then we know the theme from this year is my test, my way. Mi prueba es mi manera. So that's how it is my manner, or how this is mi manera to educate people to know like how important is to get a HIV test. And we're going to be promoting how you can get access to just get a HIV test at home, like how you can go online, just put some information and you can get a HIV home test at your home in a few days. So we're going to promote that. Plus, it's very, very important that we can continue like share this information. I think that's very important. We are amazing ambassadors that we very, very advocate with our community. Next slide. And another thing, like we just find out with my other ambassadors is that, so, and I think in this time for the pandemic, we found out that people there started like listening more podcasts. I didn't know too much about it, but now, like I say, like, okay, so maybe this is another way that people, they can continue get the information and like anytime. So what we did is like every time we have our live on Facebook or on Instagram, so we extract the audio and we put it in our podcast. So people, they just can listen all this information, all those conversations on these 3 different platforms. We have we have our podcast on the Spotify, Apple Podcasts, and Google Podcasts. So everyone, they can find our podcast like just typing Hablemos Juntos del VIH. They just type that and they're gonna find us. And they're gonna have our different topics where we talk every 2 weeks, we have a different lives. So every 2 weeks, we have those different episodes from this podcast. And this is something that people, they just can get information everywhere. You know, with podcast, you listen one time, you just put a stop, continue your thing, you do your things, or you're like doing your laundry, doing your things, and you can still listen all this information. And we bring all this idea because we know the stigma towards HIV has not disappeared and continue persist after these 40 years. So that's why it's very important for us to continue working together as a community to all that we can stop the HIV together. Thank you.
Thank you so much, Raul. And thank you to all the Charla speakers. This was excellent. And again, very powerful testimony considering we're commemorating 40 years since the first report of AIDS. I just, as an aside, I spoke with a very good friend last night who called me to say how much he appreciated us doing this Charla because he's actually living with HIV and said the stigma is still so strong, but conversations like these, which with amazing spokespeople like all of you, are just critical. So thank you again, Charla speakers, and all our partners from CVS to the CDC to Let's Stop HIV Together. And please tune in for our next Charlas, even this month, which will include one with Southwest Airlines on where you want to go now that we feel more comfortable traveling. And of course, we're going to do a Charla celebrating Pride, which we do every day at HHF and in my house. So have a wonderful weekend. Stay safe, productive, and happy. Blessings, everyone.